So now, Sushil, over to you.
Thank you very much, Suzanne. This room is cold enough. Let me take you back to Himalayas. I'm from Nepal. Nepal, you all perhaps know, between the two big countries, China and India, quite large geopolitical context that we face often. Let me bring this political economy of health financing reforms in Nepal as a case study, jointly conducted with a number of other colleagues. Briefly about the objective, I don't want to go detail, but it's a retrospective analysis with a document review and a couple of key implement interviews. How we analyzed it is basically we had this predetermined themes based on the political economy analysis framework that we used. And we moved to the context analysis, and we mapped the timeline of the various political events that took place in the last 2 decades. And then we selected the focal reform. There were several reforms, but we chose 2 major reforms as a case study in this context: stakeholder mapping, then identifying the strategies with the key policy stakeholders categories. Often we have named it as a change team here. There are quite a lot. This is a context Nepal is in. Although we are agriculturally dependent country, but our economy is largely dependent on remittances. Large number of people. Of course, the more than a third quarter. Donor funding in health sector contributes a sizable proportion, but it has gradually reduced over the years. Still, our out-of-pocket expenditure is substantially high. It raises, more than the 50%. Let me present this very crowded slide, very clumsy, I'm sorry for that. It's a political mapping of the various contexts, starting from 1990 up to the 2022. All these yellow highlights in text basically presents the political changes that took place in Nepal. But I'll be primarily focusing in 2015, in 1996, where we had, that's the year we started civil war in the country with the 40-point demand put forward by the Maoists. And in between, we had this royal massacre, different political contexts took place. And in 2006, we had this peace agreement between the Maoists and the government that was the big milestone towards the political departure to the peace. In 2006, 7, we had the second people's big movement that landed the overthrowing the monarchy and restoring Republic Nepal. So these major political changes we have taken, along with the 2015, where we had new constitution in Nepal, as a new Republic Nepal. The reform that we chosen in this case study are 2. One is the free maternity care. It's also known as Safe Motherhood Program, or AMA, which is mother. AMA in Nepali, mother in English, motherhood, Safe Motherhood Program, and the free care program. Again, I'm sorry, there's lots of text out there, but I'll pick up the main point. The Safe Motherhood Maternity Incentive Scheme, that reform was largely guided with evidence, evidence analysis, whereas the other free care program, it was largely the politically driven program rather than based on a scientific merits of the analysis. The Safe Motherhood Program, basically, it did not evolve nationwide. It has various phases, different piloting, and then understanding and informing the change process, reform process as it continued. In between, piggybacking with the changed political context with these various analysis that took place. There was a really the systematic expansion nationwide that took place in 2006 and later years, that was linked to the political dividend for the people. By providing free maternity care, removing financial barrier was one of the, considered as one of the political dividend, peace dividend people after restoration of the democratic process. Also, it was like, initially it was supported by the development partners, the flagship initial funding. Then after subsequently, whole the program was covered by the domestic funding. There was a huge political, a strong political commitment in terms of translating this reform into reality for the people. Whereas the free care program, it was politically driven. It was kind of repackaging of all the free drugs, essential drugs, which have been there for a good number of years. So it was repackaging politically. And then there was no explicit donor funding at the start, but later on it continued to move. The strategies and influence that took place in this various aspects, again, I'm sorry, the heavy-worded slide here takes quite a lot, but it's really, the building coalition was very important to tap the political commitment along with the evidence synthesization and presenting that evidence. I re-emphasize this, presenting that evidence as the political people understand. Often there is a technical dissemination of the content evidence, not necessarily that helps to get the political buy-in, and there was a changed strategy that took place. At the bureaucratic level, it was very closely working with the external development partners technical assistance program that was embedded within the Ministry of Health and Population, supported under the sector-wide approach, and the pool funding mechanism that worked initially to seed the money for this kind of reform that had a strong evidence backup. Also the beneficiaries politics, there was a sizable engagement of the community and the civil society organization. And not to be really underestimate the role of civil society organization in this various reform process, not only the technical aspect, but very much political linkages of the civil society organization. And if they are committed to the reform, and that was taken to the higher level, and change process actually gradually took place. There were some prerequisites for the reform that I would like to highlight. No matter how good policies are there, supported by the political reform process, if you don't have a very clear, competent infrastructure, a competency in place in order to translate the political reform to the reality, then the reform does not really produce the result. And this is what we retrospectively found in Nepal. The strong political reform has to be supported by the educated capacity within the Ministry of Health and Population in order to implement and get the results tracked. Various capacity enhancement measures were put in place that as one of the fundamental things in order to really proceed the reform, the change process, which takes a long time. So that mechanisms were also supported by the technical assistance program, supported by the development partners. There were lots of reform, not only these two case studies, there were lots of parallel reform. And sometimes mapping these, what's going on, all this parallel reform, are they really producing the collective results together or not? It was really interesting to see. The facilitation of the policy dialogue, there were multiple forums were created. This morning in plenary session, we also heard about the political dialogue, or the policy dialogue, communication. That was one of the prerequisites, as well as reform started with the public facilities, and then it was gradually expanded to the private facility in terms of its expanding the coverage. This is my last slide. I'll have key reflections and lessons from here. is basically the timing of reform was very important. It was really linked. Nepal is a very fragile political context that remained for a longer period of time, starting from civil war to the peace agreement, and then 2015, big earthquake in Nepal, and so many other crises we had. But it was really important to have this partner coordination, coalition building, and then seizing this timing in order to pursue the reform forward was one of the lessons that we learned. And crisis and circs, major turning point we observed in Nepal, the context. Also the very strong evidence base, lightening this evidence and presenting evidence in a way that political actors, champions, the change team really understand. And not to be forgotten that Nepal stood up very strongly on the right-based approach and the basic healthcare services, the fundamental right, right of the people that reflected in the constitution, that actually driven the component forward. Also the partner coordination and aid harmonization, not always easy to bring all the partners on the common agenda. However, there is a process involved. It takes a long time, but the sector-wide approach basically worked fundamentally on this process forward. Also the twin-track approach of the reform, because reform was not only directed to the strengthening the supply side measures, but also it was linked to the demand creation, engaging people to understand their demand and delivering demand from the supply side arrangement. Evolving agenda and changing actors. And it was a painful process because something initiated, then because of the political fragility, there were so many changes of actors in between at the time. But getting them again on board and then keeping the momentum of reform was a challenge. Despite this fact, we had this reform process kicked off, still impact, what the impact it brought. Still we stand more than 50% of out-of-pocket expenditure here. So we need to really evaluate how this reform actually contributed to the original goal that remains critical to be answered. Thank you very much for your listening.
Thanks, Sushil. Thanks for the very clear message that delivering on benefits is in a political act as much as it is a technical act, and how important it is that the political without the technical is not going to be effective. Thanks, Sushil. Over to you, Sophie.
Thank you very much. So I'm going to try and look across the two case studies and just look at some similarities and differences. And thinking very much, as Susan said at the beginning, about practical strategies for actor management and what can we learn as we discuss all of the reform initiatives we're interested in across the countries here at the conference. So I might even stand where I can read them now. Struggling to read them from the slide. So the first set of reflections is around this issue of context. Obviously, one of the questions we were most interested in was the way that crises were used. Oh, thank you, that would be great. If I'm blind woman. Yeah, so it's obviously crises can enable, crises can also block. So what did the two case studies tell us about that? And the first thing we noted was that in both cases, the crisis seemed to lead to a new political settlement, and that new political settlement itself became the enabler for reforms leading to greater coverage, and particularly in both cases focusing on rural protection. So in the case of Thailand, as we were hearing, it started with a financial crisis which led to a new government with a populist offer. And as Aungsumalee highlighted, we might have expected a period of fiscal crunch, of fiscal constraints to make reform more challenging, more problematic. And what's interesting is the way in which it created this kind of urgency and actually directed some of the content of the reform around cost control. So in the case of Nepal, it's a civil war is the background story, and then a peace agreement. And the demands of the Maoist group also feeding into this strong need for health sector reforms. And the issue of communism is interesting because it comes up in both cases, but in a very different framing. So in the case of Thailand, there was an argument made around stopping the spread of communism, that for that reason, you know, enhancing the coverage and the kind of political offer to the population would be a strong case. In the case of Nepal, it's actually incorporating the Maoists and the communists into the unity government that drove some of this constitutional change and that Sushil was talking about. So social inclusion, participation is obviously a strong key theme in both cases. And in Nepal, you also have a follow-on dynamic which is linked to federalization, because one of the political demands was a more federal system. And that in itself then drives some of the reforms. In the case of Thailand, this very strong emphasis on participatory engagement. So one question, as I said, was the role of context. We were also interested in just seeing how this kind of window of opportunity came out, and thinking also particularly of the kind of kingdom framing, that the argument that you need to bring together the policy, the politics, and the problem streams to have successful reforms. And I think particularly in these case studies, we do see the way that the crisis impacts particularly on the problem and the politics streams. So in the case of the problem, there was really a sense of urgency about some of the challenges of catastrophic expenditure, of rural poverty in the case of Nepal. So a deepened awareness of the problem, but also the politics stream changes. So in both cases, you've got this sense of important political dividends that are going to come from addressing the problem. And then the policy stream, of course, is also important, although I personally see quite the same influence of the crisis on that. But there's a very well described from the case studies set of technical options which were elaborated in Thailand through a whole load of prior experiences and also through the work of the change team. And in the case of Nepal, as Sushil was highlighting, specific studies commissioned to identify ways of moving the reforms forward. So what did we learn about the stakeholder management, and particularly this question of change team, which comes from the WHO framework that you'll all be familiar with, I'm sure you're using in your daily practice. I think there's quite a different role of the change teams across the two case studies. So in the case of Thailand, there seems that there was a very clear group of people who are linked through background, orientation, practice, who did work together in quite a concerted way. And as we've highlighted, there are various features of that team that are important. There's technical capacity, there's political skills, there's also good connections with key stakeholders. So they've got this, they were also, we think, were seen as both politically committed, but also politically impartial, which I think is a really interesting combination. So not party politic, but having very clear idea of the direction of travel. So there's a close-knit group, they have key contacts, and they also have experience in navigating bureaucracy. And the other feature, one of the many features that were highlighted by Aungsumalee was their ability to mobilize different sources of power. So in civil society, also at the political level, in the bureaucracies, but also working with international partners, using evidence strategically and actually cementing the reforms through international approbation that came back about the Thai reforms, making them harder to reverse, which is kind of interesting. So you see this kind of policy entrepreneur. In the case of Nepal, I think there were groups and individuals supporting reforms, but they were a bit more fluid through time. And I don't think they worked, and again, Sushil can say if he has a different view, but I don't think they worked in quite as a sort of concerted a way. So what are the strategies that have emerged across them? As we highlighted, coalition building was obviously one of the important methods or mechanisms that were used, mobilizing political support. But also in both cases, you see a very active enhancing the legitimacy of the policy. So in the case of Nepal, there's the role of the MDGs plays an important role. This rights-based approach was really important. And in Thailand, there seems to be a very strong link to traditional social values of the way the community organizes itself. So in both cases, groups were able to kind of create and enhance those legitimacies. Of course, we see strategies around addressing opposition as well, particularly in Thailand, and potentially we think that's because there was potential greater opposition. So you see more strategies linked to that. And as I highlighted, the external partners are obviously a key part of the landscape, but do play a very different role in Nepal versus Thailand, because in Nepal, the financial dependency on the partners for financing policies and for financing a lot of the health budget generally creates a different relationship in which the mobilization has to be more active. As I said, in the case of Thailand, it's more about using international evidence, but also getting international documentation of the Thai experiences. I mean, speaking in conferences like this, for example, early on in the reforms, actually created a very positive impression of what was happening, which cemented what was going on in Thailand. So, other strategies which I think are important, just to reiterate, they did come out of the presentation, but one of them was mentioned by Aungsumalee is changing decision-making rules. That seems to have been quite strategic and successful. So, for example, budget decisions were moved to the Prime Minister, which meant the Ministry of Finance couldn't oppose certain spending decisions. And there were also creation of bodies such as the National Health Security Board and then the National Health Assembly, which created a new support base. It mobilized support, it changed the landscape in an ongoing way. It actually reduced the future margin of maneuver to reverse reforms. And then dialogue. We heard a lot about dialogue in the plenary this morning, and it comes out very strongly out of both case studies. So seeking common goals, bringing in opposition demands. And the key informant interviews were very strong on this, talking about strategic use of participation, win-win narratives. So once the initial key elements of the reform were in place, there was then a more incremental approach which really built on an ongoing dialogue. And I think it's important to highlight that probably worked well in this case because the change team had a very clear sense of direction. So it didn't result in a kind of drift, which I guess is one of the risks of having a very open dialogue process. Evidence highlighted in both case studies. Strategic use of evidence really important. Of course, we want to hear that because we're also a research conference, but it does indeed emerge organically from the case studies. So locally relevant knowledge, of course, very important. We've highlighted the ability of the change team to not only generate local evidence, but also draw on appropriate international evidence, but translate it, this is a critical element, translate it into terms, into evidence that is usable locally for decision making. So not too much. You can, I think we're probably all familiar with this, scenarios where you have too much evidence, it actually becomes a barrier to moving, to making decisions. So knowing how to bring in enough evidence, not allowing it to get bogged down with let's have yet another study, but we're keeping the pace going. And this is a highly skilled role. So you're combining, evidence generation, evidence synthesis, political skills, policy dialogue skills, etc. That's a key element in the success. And in the case of Nepal, as we highlighted, quite a lot of very specific studies were generated, particularly to monitor the policy as it went along. But I think it's probably true to say that the National Health Sector Support Programme, which was one of the main evidence-generating groups, didn't have quite the same independence and sort of independent but close to policy status as some of the establishments in Thailand. So I think we also need to think about the structures of our evidence generation, synthesizing knowledge management, if you like, groups. The pace of reforms, quite different. The Nepal ones we described took place over a decade. The reforms in Thailand were relatively rapid, at least initially. And again, there may be a reason for that, which is that if you're anticipating more opposition to your reforms, then it makes more sense to move more quickly. If it's more diffuse, then potentially you can take a slower approach. see Susan's indicating to me. Talking too much, right. Technical elements of reforms. I won't say very much about them, except of course they are critical to the political economy. In particular, they change who wins, who loses. And in this case, we're looking at what were at their heart kind of pooling reforms, potentially much more politically controversial because they're changing who benefits, and therefore also, I think, sometimes harder to reverse. And again, I'll be interested in Joe's views on this topic. But the risk pooling was more extensive in Thailand. And as Sushil was saying, somewhat more shallow in Nepal in terms of the protection that was provided. But in both cases, there's also an element of purchasing and provider payment reforms, particularly to provide cost containment, which were essential early on to make sure that you didn't get locked into an expensive policy. I think we also see the importance of adaptive learning, so this flexible approach that's taken where you don't get locked into mistakes, you can have continuous improvement, and you can also respond to criticism and take on, you know, opposition, concerns, and interest as you proceed. So final reflections on the strategies. Of course, these are very, very contextual. We can't ever come up with a menu to say, this is how you need to do it in all situations. But I think there's a few kind of key points that do seem to emerge. Obviously, the value of the change team comes out strongly, one that's well connected, that has clear goals, that's technically as well as politically savvy. The benefits of speed, particularly if you're anticipating organized opposition. I think the importance of connecting to social values is something that comes out strongly from both case studies. And also this strategic use of dialogue to create win-win situations. And I think that very much chimes with the kind of Ukraine example we heard this morning. Changing decision rules to reduce the veto power of the opposition, I think, is something that's very interesting that comes out of the Thai case study in particular. But also this issue of how you iterate while keeping a clear goal in mind. And finally, encouraging participation and transparency to mobilize support of beneficiaries is really a strong strand from both the case studies. So just a few key points, and we look forward to further discussion and questions. Thank you very much.
Thanks, Sophie. Okay, so we're going to take a risk and take one round of 2 or 3 questions for this panel before we move to the next panel. So please, I get to choose, and then Sophie will have to choose, so then we won't be. Mickey, I saw your hand up.
Thank you very much. Thank you very much. It's Mickey Chopper from the World Bank. That was really interesting, and thank you. One common theme of both sets of reforms was a shift to rural health services and really trying to move resources and systems and strengthen systems in rural areas. And just wanted to get a reflection from the team. You know, it seems now, de facto Thailand, it has seemed to have worked. The rural-urban differences have narrowed, at least until recently. Whereas Nepal, they still remain quite stubborn. So any reflections on that sort of difference between the seemingly both being successful at reforms, at moving resources and strengthening capacity at the rural areas, but in terms of actual results, quite different outcomes?
Thanks. Okay, and then maybe right in front of you, and if you could introduce yourselves as you.
Hi, my name is Shabana Haider. I'm the country director of Think Well in Pakistan, and I was earlier working with the current Prime Minister as a part of the health reforms team. My question to the panelists is that you took us through your case studies of how the reforms took place and what are the necessary key ingredients or the recipes or the enablers or the strategies to do these reforms. From my practice and experience, doing reforms and sustaining reforms is very, very different. So do you think, it's an open question to the panelists, sustaining reforms, do these ingredients or do these strategies work? The same strategies, different enablers? So I would want some reflections on that. Thank you.
Okay, great, thanks. Okay, maybe we'll turn it over to the panel.
Yeah, I think for the Nepal rural-urban differences, I'm going to pass to the left.
Thank you very much. Very interesting question. Just to take you into the account, the context of Nepal is 80% population reside in rural area. Rampant poverty, rural poverty exists. There's a lot of political interest in terms of really doing something in the rural area. Whereas that does not mean that there is no urban poverty exist. There's a huge urban poverty. However, the evidence synthesization process that actually focused more on the rural area. In a way, it marks the urban poverty during the process of evidence generation, because the focus was greatly on the rural area. The reform oriented, based on this, the evidence synthesization process, and focus more the rural area. That's the reality. However, the understanding the later days is a greater acknowledgement of the fact that the reform required to be balanced to the urban and rural area in terms of like addressing the needs of the poor people. So now that taken into account as the reform continued to get implemented, and then the process, there was a reform revision at certain point of time towards focusing on the urban poor as well. That's how Nepal sees.
Yeah, I think there might have to be a follow-up in the coffee break about that, because there's quite a lot of, in Nepal, it's a lot of the analysis around the ecological regions. And actually, when we look at those reforms, they were differentially effective between the mountain and the kind of mid-level and the Terai, weren't they? And between the supply and the demand side components as well. So there's quite a lot of detail in those, this kind of, the studies that are done of those. I'm not sure we have time to go into all now, but I think it's a really important follow-on discussion to have, maybe. Just on the sustaining reforms question, absolutely, key issue, because we're not just interested in reforms happening and then they all sort of fall apart. Clearly, that's not the aim. So I think in these case studies, just to say, some of them were quite long-term. So, we were following the story somewhat. We weren't just looking at the moment of change and restructuring or whatever. And it is interesting how certain reforms kind of did get locked in. And that doesn't mean they're fully effective, because there were quite a lot of challenges, especially in Nepal, because it's a more challenging context in many ways. But nevertheless, we probably didn't present it in that kind of phased way, because it's a very quick summary today. But as we write them up and look to publish them, yes, we will try and look at it a bit more by phase. How do you sustain? And I do think it's a different set of skills. So that's a really important thing for us to bear in mind as we write up. I've got a feeling.